Hi, Dr. Sasse here from the Continence Center. A number of people have asked to talk a little bit about bladder leakage repairs and what can be done to create some kind of repair that solves that problem. We certainly know that bladder leakage is a very vexing problem. It's frustrating. It often starts out mostly for females, but it does happen in men as well, especially as we age a little bit. And it can occur when we cough or sneeze or when we do exercise. And most people, frankly, just put up with it for a number of years. However, because it is a progressive problem, as the nerve signaling gets a little bit worse over time, we lose that proper coordination of the pelvic floor musculature, and the sphincters and the coordinating effects that take place with the pelvic floor gradually lose their effectiveness and their proper oomph. So we start to get more and more leakage. And then people resort to pads, they try medications which don't work that well and have a bunch of side effects. And then they start thinking about what can be done to solve this frustrating problem. So historically there have been some repairs, and I mean truly attempted repairs. It starts with using devices, so there's insertable devices. There's one called a pessary, which is meant to sort of hold things up as they're trying to prolapse or fall out. There's also a type of device that's meant to basically plug the urethra. These are sort of inconvenient and don't work all that well, as you might imagine. And then there are surgical repairs. So the one that you most commonly will hear that people have done are called slings, right? And this is using a type of prosthetic material to hold up the neck of the bladder and make it so it's less likely to leak. And while each of these has their pros and cons, none of them is anywhere near as effective as what's called sacral nerve modulation. And this is a repair, but in an indirect way. What it's really doing is functioning like a pacemaker that restores that nerve signaling function. Just like a cardiac pacemaker restores the nerve signaling function to the heart muscles, here this is a pelvic floor pacemaker that restores the nerve signaling, the transmission lines get back in order, talking to the pelvic floor muscles and sphincters. And so it restores all of that function with a much less invasive procedure. In fact, there's no cutting or touching the bladder at all. It's simply done by placing this little pacemaker device in a little subcutaneous spot kind of on our tailbone area. So it's an indirect type of repair, but you'll find as you dig into that FDA-approved treatment is covered by insurance and has a way higher effectiveness than a true surgical repair where we're diving right into the area and trying to fix the anatomy. Other types of indirect treatments would include Botox injection. You may have heard about this. This is where the doctors inject directly into what's called the detrusor muscle. And this is a way of sort of allowing the bladder to hold a bit more urine before you have to go. But again, kind of short lasting, maybe some weeks to a few months. And then it has to be repeated all the time. So not the sort of long-term repair or solution that we would like. So if you're searching for or thinking about repairs that might be done, take a good look at sacral nerve modulation, because I think you'll find that it's quite a bit less invasive and has quite a bit fewer side effects than any actual sort of interventionist surgical repair. It certainly changed how we practice. In the old days when I first came out of training, we did quite invasive repair work for the pelvic floor and for the sphincters, only to see that those procedures have a lot of complications and they're a bit difficult, and that we have much better results with the indirect method but less invasive and highly effective method of sacral nerve modulation. So I hope this has been helpful to you and has kind of given you the broad outlines of what is available for bladder leakage repairs. And with that, I wish you great health and all the best.